Good morning, everyone. This is our first promotional video from Concepts ADC online mentoring program for ADC Part 1 written examination. In this video, we will be talking about different concepts in SBQs. I have taken one SBQ in this video and I will be discussing what concepts are present in that SBQ. Basically, if you look at the ADC Part 1 written examination, um, all are scenario based questions. But there are some concepts for each subject. If you are thorough with those concepts, it is easy for you to crack the SBQs. But if you are going with the SBQs, then every time when the question is changing and you don't have thorough knowledge in the concept, then it will be tough to answer those questions. So for particular subject, some areas of concepts will be there. If you are thorough with those concepts, then when you are facing questions, it is easy to answer those questions if you are thorough with those concepts. So coming to this SBQ, the SBQ is a female patient of age 45 years has reported to your clinic with history of periodontitis, and she has undergone treatment for periodontitis with periodontist and recently moved to this area. So she came to your clinic for regular checkup. So basically a 45 years old female patient has reported to your clinic and she has an history of periodontitis, key point, and then she has undergone treatment for periodontitis and with the periodontist and recently moved to this area, so she want to get regular checkup at your clinic. So first question is, which assessment will you undertake in this patient during clinical examination? And the choices are mobility, basic periodontal examination, bleeding on probing indices, and then full mouth periodontal assessment and probing depth. So basically when you look at the choices and if you are clear about what is the basic periodontal examination, and you can easily see what is the answer for this. But if you are not thorough with those areas like what is a full mouth periodontal assessment and then basic periodontal examination, then you will be struck up whether to keep the answer basic periodontal examination or full mouth periodontal assessment or probing depth or bleeding on probing. So when you are looking at the choices without much knowing about the concepts of that question, then it is tough to answer. But if you know what is a basic periodontal examination, then very easy answer to this question. So I will discuss after the 5 questions in this SBQ what are the concepts in the present SBQ. So coming to this, the answer is full mouth periodontal assessment. So we will discuss why is the reason of full mouth periodontal assessment after finishing the 5 questions. And the next question is, on examination you found 1/6 and all third molars are missing and remaining all teeth are present and 2/7 is grade 3 mobility which need to be extracted. So after extraction of 2/7, what is Kennedy's classification? So the first question is about the perio, and then it comes to the prosto question where all third molars and 1/6 upper left first molar is missing, and then 2/7 is grade 3 mobility which need to be extracted. So now after extracting the 2/7, what is the Kennedy's classification? So this question is about the Kennedy's classification. So when you are thorough with the Kennedy's classification and the rules of the Kennedy's classification, it is easy to answer this question. If not, then you will be stuck up whether it is a class 2 modification 1 or is a class 3 modification 1. Okay, but in Kennedy's classification there is one more rule that we will be discussing in the end of this session. What is the rules of the Kennedy's classification? But if you are thorough with that, then it is not either A or D. It is depends on the replacement of the 2/7 of the patient choice, whether the 2/7 he wants to be replaced or not. So when 27 is replaced, then it changes to one classification. If it is not replaced, it is another classification. So basically 27 plays a key role. So we'll come to those rules at the end. And the third question is, which probe is used for periodontal examination? Basically, this question is not related to the SBQ. It is a general question. So, which probe is used for periodontal examination? But in this question, it was nothing written in this current scenario which probe is used for basic periodontal examination like that. So, it's basically a general question, which probe is used for basic periodontal examination. But if you are thinking that this question has a link with the first question, then you tend to change the first question to the basic periodontal examination. Please look at the question when you are answering, whether that question is related to the present scenario or is it a general question. And in this question, nothing has been mentioned that this question is related to the present scenario. This is mentioned is which probe is used for basic periodontal examination. So the answer for that is WHO probe. So in the basic periodontal examination, they will be clearly mentioning what probe is used for examination and how do you use the probe for the examination. And the fourth question is, on examination with the probe, black band of the probe is completely visible with bleeding on probing and overhangs are present. What is the score in basic periodontal examination? So here it is mentioned on examination. So this is related to the scenario. So basically when you are checking the patient with the probe, so nothing has mentioned which probe is that. So and with the probe, a black band of the probe is completely visible and with bleeding on probing and overhangings are present. What is the score in the basic periodontal examination? So basically the score is 2. If you are thorough with the BPE, you can easily answer this question. And every time BPE, definitely a question will be there because it's a basic thing for a dentist to know about the BPE. So without that concept, you cannot go for the exam. That's a basic one. And then the next one is staging and grading. That is also a very basic one. Without those concepts, we cannot attempt to write the exam. And definitely we can expect at least 2 or 3 scenario based questions on these 2 concepts only. And then at present patient is not having a previous records, and how will you access a previous record? You ask your practice manager to talk to her previous clinic and get her records, or you directly contact the periodontist and get access to her record, or you inform the patient to contact her previous clinic and get access to records, and it is not possible to access patient's previous records. So if you know about the patient record maintenance area, then it is easy to answer. Either one option is you ask the patient to go and get it, or you take the consent of the patient and get access of the record. So since she has moved to your clinic, to your area, we cannot ask patient to go and get it. So we can take the consent of the patient and get the access of the records from the previous clinic. So the answer for this is we inform the patient to contact. The answer for this is you have to take the consent of the patient and then take access of the record from the previous dental clinic. So when we look into this SBQ, 3 concepts. One is basic periodontal examination, Kennedy's classification, and dental records. These 3 areas were there in this question. So if you are thorough with those 3 areas, it is very easy to answer this question. So we will just go through these concepts. So PPE, So what is a basic periodontal examination? All new patients should have BPE recorded. So whenever you get a new patient, you should record a BPE. And when you have a patient codes of 0, 1, 2, you should record it at every routine examination. Okay, but when you have a 3 or 4, then you need to have a detailed periodontal charting is required. That means 6-point periodontal charting. In that 6-point periodontal charting, you will have probing depth, bleeding on probing, recession, mobility. All these points need to be checked in the 6-point periodontal charting. When you go with the code 3, you need to have initial therapy including self-care advice and then post-initial therapy and a 6-point recording chart in that section only. So basically, when you are recording with the BPE, you have 6 sections. That is upper you have 3 sections and lower you have 3 sections. That is from second molar to first premolar 1 section, and canine to canine will be another section upper, and then first premolar to second molar upper will be the third section. Like that you have for lower molar, second molar to first premolar, and then canine to canine, and then lower first premolar to second molar. Like that, these sections are divided. So if you have a code 3 and code 4 in particular section, you cannot stop with the BPE. You have to go with the 6-point periodontal charting. So important thing, BPE cannot be used to monitor the response for periodontal therapy. You have to assess the response with the 6-point pocket charting. So you have, once you have done a periodontal therapy, and to monitor that response, you cannot use BPE. And patients who have undergone initial therapy for periodontitis and right now who are under the maintenance phase, then full probing depth throughout the dentition should be recorded at least annually. So this point clearly mentions that we cannot take a BPE for a periodontitis patient. So if you can know these basic concepts of the basic periodontal examination, then the first question we would have easily answered that it is not BPE. We have to go with the 6-point periodontal charting. So that is one. And then around the implants also, you cannot go with the BPE. And then when you are using the 6-point, you have to record the bleeding on probing. So BPE can be recorded for new patients, and if you have 0, 1, 2, each time you record the 0, 1, 2. But if you have a code 3 and 4, no, you have to go with the full periodontal charting. Okay, that is the basic concept in the BPE area. Okay, so we will go to the next concept, that is Kennedy's classification. As you know, everyone, what is a class 1 and class 2? So when all the posterior teeth or bilateral edentulous area located posterior to all the remaining teeth will become a class 1, and if it is a unilateral edentulous area posterior to the remaining teeth becomes a class 2, and then unilateral edentulous area but you have a teeth anterior and posterior, that is a class 3, and class 4 is you have a single but bilateral edentulous area located anterior to the remaining teeth that is crosses the midline, so that becomes a class 4. So this is very clear to us, but when you come to the rules, you have 8 rules in this. You have a classification should follow rather than precede extraction. That means once the extraction is done, then only you count the classification. You cannot go before the extraction. And if third molar is missing, not to be replaced, it is not considered in the classification. That's fine. So it is third molar is not there. You are not replacing that. You don't consider. But if you are replacing it, then it is considered in the classification. If third molar is present and it is used as an abutment, it is considered in classification. So when third molar is present and you are using it as an abutment, so it becomes a considered in the classification. For example, 2.7 is missing, only 2.7, and you have 2.8, and you want to take it as 2.8 as an abutment, then it becomes a class 3. But you don't use it as an abutment, then it becomes a class 2. So that is what is mentioned. If third molar is present and to be used as an abutment, it is considered in the classification. And if second molar is missing and not to be replaced, it is not considered in the classification. So when you look at this previous scenario, we have not mentioned anything about the patient wants to get replace of 27 or do not want to replace of 27. So then it depends on the replacement of the 27 will be your choice, because if he says that I want to replace 27, then the classification is changed. If he doesn't want to have to get replaced of 27, then you get in a different classification. So if you look like that, it depends on the replacement of 27. So that is what the rule 4 says. If the second molar is missing and not to be replaced, it is not considered in the classification. If it is going to be replaced, then you have to consider in the classification. The most posterior edentulous area determines the classification. As you know that the edentulous area in the most posterior area will determine the classification, and edentulous area other than those determining classification are called modification phases. So basically most posterior area will become your classification. Other than classification area, what all spaces are there, that becomes as a modification, and it is called as number of modification phases, but you cannot count the how many teeth are missing in those modification. And the extension of the modification is not considered, only the number. So basically how many teeth are missing is not considered, and but how many modifications are present, that's what we are going to consider. So there is no modification in class 4. That is one important. If it is a class 4, no modification. So it is only a class 4. You don't have a modification spaces for class 4. So when you can able to know these rules properly, so you can easily attempt that question also. So my intention here is, so if you can able to have concepts, you can easily write the SBQs. ADC department will be easier. But if you are only with the SBQs, each time the SBQ is changing, then it is tough to crack the ADC department. So better it is to concentrate in the concepts, will have a good hold for the subject, and you can easily answer the questions. And the third area is the dental records. So it is recommended when a patient seeks to access their dental record, the dentist should offer them to meet with the patient and explain the records to them. That's the basic thing. So if not possible, you can take a consent with the patient and then meet contact to the previous clinic and then get the access of the record. So consent of the patient is very important to get the access of the record. So this is the first promotional video from Concepts ADC online mentoring program, and we will be starting online mentoring program from October 3rd week, where we'll have a live sessions on Saturday and Sunday. It will be a duration of 10 to 12 weeks that we will be finalizing in a couple of weeks, and we will be releasing the brochure of the program also, where we'll have a detailed mentioning about each week and what are the lectures going to be covered in each week. So we will be discussing about the concepts for each subject, so that the participant and the delegate will be having much knowledge about each concepts in the subjects. So I wish you good luck for all the aspirants for the ADC Part 1 written examination. Thank you.